Hi, I'm Tony Timm, and over the next few minutes, I'd like to talk to you a little about community partnerships and my experience in developing them and working with them together with community partners. This is based on my experiences over the last 20 years working for various sized nonprofits, for-profits, and as an elected city council member. In all of these experiences, I was tasked with trying to figure out ways to get better results with less resources. Like many of you, we've been working collaboratively with community partners long before community partnerships were just a couple of buzzwords. I think we can all agree that in today's world, we often are asked to do more with less and working smarter together and not just harder on our own. Now, I don't mean to make it sound like partnerships are easy by any means. Often, they will likely take longer and be more frustrating than doing the work on your own. However, we can't have success without working together. Partnerships will often lead to better sustainable programs for the long term and provide better outcomes for our clients or our organizations that we're working on behalf of. I think most of you probably also have good and bad experiences of working together pop into your head when we start talking about community partnerships. At times, working collaboratively turns out like that group project you did in college. You know, the one where 3 out of the 5 people did the work, but all 5 people got credit. We all know that the real world is very similar. However, for those of us doing the work, we often don't care ultimately who gets the credit. We're just working on behalf of individuals and organizations that need to solve problems in communities. I spent 7.5 years as the CEO of Central Iowa Shelter and Services, Iowa's largest low barrier shelter for adult men and women. When I took over for the organization, it was clear to me the issues that people were facing were greater than just not having a home. Had everyone just needed a roof, we'd have been very successful right away. However, most of the folks that we were working with, 300 plus a day, had issues beyond just experiencing homelessness, whether that was mental health concerns, healthcare concerns, lack of education, substance abuse. There were a lot of issues that people were facing that led them down a long path to us. And for us to give them a real chance back at being self-sustainable, we had to think outside of the box and more creatively on how we were going to provide them with opportunities going forward. As a small organization, we didn't have the resources to do it all on our own. We were also tasked with looking for space, land to build a new facility, one that would be a greater opportunity for the folks that we were serving. And in fact, what we built was a much greater program than just a new shelter. In our minds, it was more of an opportunity center. We were able to focus on the community and resources within to have a better outcome for the folks that were staying with us. We spent the better part of 3 years before we even broke ground on the new facility, contacting organizations in our community and looking for key partners. We knew that both the partners we were looking to work with, as well as ourselves, we both had to have a common goal at the end of this, and that was helping people. We knew that we needed healthcare, mental health, job training, food, clothing, financial assistance, housing, and not just housing, but affordable housing for folks that are below median income. We took a lot of time, a lot of conversations looking at how we could accomplish this. When we opened our new facility in 2012, we were able to capitalize on a lot of those community partnerships. We were able to include a healthcare clinic that was serving people on site a couple days a week right in our facility. We had the community college teaching high-set classes to our members on site in our classroom. We had the local food pantry open a site, then we were a community food pantry site. We were able to bring in job training, both in our kitchen as well as in our garden area. And we were able to give folks a real chance at getting back on their feet. Most of those partnerships are still going today. Some have changed over time, but one of the key ones was after we opened, we still realized that we had a huge need that was unmet in the folks that we were working with. And it was really brought to our attention when the fire chief came over to visit us one day and shared with us that we were calling an ambulance 3 times a day. Now, most of those were probably non-emergent, but they were taking city resources to transport them from the shelter to the local hospitals. And they were tying up an ambulance, emergency rooms, physician time, and then when maybe that's not what they needed. However, because we weren't healthcare professionals, we weren't equipped with determining whether or not they needed an ambulance ride. So we went back. We had a lot of conversations with our local community foundation. We had them assist us in getting people around a table, and we invited corporate elected officials, foundations, individuals, community leaders, and we had a long discussion. Over the course of a few months, we pulled a lot of data together on the number of rides the ambulance was providing. We associated costs with that, as well as hospital costs. And we had a theory that if we worked together and we staffed the healthcare clinic 7 days a week during the busiest time of day from 5 to 9 at night, that we could reduce those ambulance rides. At the end of our 6-month pilot, we were successful. We went from about 3 ambulance rides a day to 1, and often that 1 was necessary, and it was determined so by the healthcare staff on site. So we were able to reduce the number of rides by 2/3, thus saving the city money with their city ambulance service, the strain on the local emergency rooms, and as well as the cost for our clients to be there. Through this project, we learned it was quite clear that we knew what needed to be done. We couldn't do it on our own, and it was going to need to be a community-wide effort. Thanks to other organizations that were willing to collaborate with us and see the value in working together, we were able to have a more sustainable program. I think most of you will have similar results if you think about who your key community partners are, who's doing similar work that could come alongside you, and how you could look at the member as a whole that you're trying to serve. Often folks think if they just address one issue, that the individual is going to be self-sustainable. Often people need their daily needs met, they need to feel secure where they are, and they need to have access to all the services that they may need. And while no one organization can do it on their own, I truly believe that by working together and providing all of that support for an individual, we can prop them up and keep the stool from falling over and dumping them off. So please give some time and thought to how you could work better together. And I thank you for your time today. Thanks.